IMRT, or intensity modulated radiotherapy, has the advantage of being able to better conform radiation to tumour volumes whilst minimising dose to healthy tissue. IMRT allows for different levels of dose to be given to different areas defined in a treatment field. What we're viewing here is a patient with a prostate tumour. Each patient has a personalised plan that considers the unique characteristics of the patient and their cancer, including the size and location of their tumour. We begin the pre-treatment planning process by acquiring CT scans of the patient immobilised in the position they are going to be treated. This helps replicate the actual treatment position, where movement has to be minimised. The CT scans enable us to create a treatment plan, outlining the planning target volume and organs at risk, where we want to minimise radiation dose. In this case, you can see that the prostate, which is green, touches the rectal wall, which is shown in red. IMRT allows us to deliver a 3D conformal dose of radiation to the prostate, whilst minimising the dose to the rectum. The other thing to note is that we treat the patient with a full bladder, shown in dark blue. This is so that the small bowel, shown in light blue, is pushed outside the radiation field. When the patient arrives for their treatment, they are set up on the treatment couch using the green lasers that you see on the screen. We give the patient reference marks. For a prostate patient, you would normally have 3 marks, anterior and laterals. By aligning the marks with these lasers, we can ensure that the patient is in exactly the same position as they were when they had their CT scan. Now we can see the linear accelerator delivering one of the treatment positions. The patient would typically have about 5 different treatment positions, with the gantry head at different angles. With IMRT, the shape of the beam is constantly changing thanks to the multi-leaf collimators, which are independently moving strips of tungsten alloy situated within the gantry head. This allows for dose to be modulated across the treatment field, building up a high 3D dose of radiation to the tumour volume, while sparing the surrounding organs at risk. The colour wash on the screen shows the level of dose that is received by the prostate and other organs within the pelvis. You can see that the prostate, represented in dark red, has received the highest dose. During the planning process, we set a maximum dose level for all organs at risk. As you can see, the smallest of external or internal motion can result in inaccurate plan delivery and increased damage to organs at risk. We try to minimise this by immobilising the patient and by employing image-guided radiotherapy, or IGRT techniques. A patient like this would normally attend for 37 treatments, and we would image him throughout this period to ensure that his tumour and organs at risk remain in the same relative position each time he is treated.